Good day, everybody. I'm Dr. Neda Amani, and welcome to the Dr. Ned Show. Today, we have an exciting, very, very fascinating, knowledgeable guest that I'm so pleased to welcome, Dr. Carolyn Turek. Carolyn, welcome.
Thank you, and hello. I'm so excited to be here.
I'm so excited to have you. We have a very ambitious project before us today, Carolyn. Is it okay if I call you Carolyn?
Absolutely.
Dr. Turek, Carolyn. You and I have been in journey. You've been on the journey longer, although you don't look it. You look fantastic. And that's what we want you to also talk about, the secret of that fantastic look. You've been on this journey longer than I have, about a whole full decade, of how to, as you're trained, and I'm going to get you to give us a little bit of your background, but I want to introduce why we have you on today and what's the ambitious vision that we have in sharing with everyone your background and the vision that we both have. You've been on this journey for, again, a decade longer than I have in bringing real medicine. We're going to call it the language of real medicine to the masses, to your patients, and also how you live that real medicine, which I think is really important. The doctor, the one who's giving the medicine, to live the lifestyle of what is really meant to be health and well-being. And that's the reason why I really wanted to be able to have you on today, so that you and I could both speak into form this new era that we have ushered in for real medicine, real healthcare, as a lot of us are being connected right now during this crisis and this transformation of our world. We're being connected through responding to this transformation, but it's also a great opportunity for us to now bring in what we know to be real medicine to the masses. So welcome.
Thank you.
Welcome. And do you want to start with sharing your background and your story?
Sure, absolutely. And thank you for the compliment. It's hard to believe it's been a long journey. 30 years I've been practicing now. I can't believe it. And when I did start practicing family practice, I know my patient said that I looked like I was 16. So I hope I look older than that now. But
well, 24. I was going to say 24. You look fantastic.
A lot older now. So, but my background is I actually come from Thunder Bay, a small community in Northern Ontario. Did my undergraduate at the University of Waterloo in health studies. So it was a science program, but I really enjoyed it because it was a lot about health promotion and prevention and nutrition. So some of my background and how I practice medicine, I think, came from that program. And graduated from University of Toronto in 1990.
I didn't know. I'm a U of T grad too.
Oh, is that right?
Yeah. I didn't know. I'm 98.
Okay, got it.
Okay.
Yes.
Wow.
You're younger than me. And then I've practiced in Durham region ever since. And that's taken me on a journey. Started in family practice. And in those days, we all did hospital as well. So we saw hospital patients, surgical assisting. I did public health, a little bit of everything. And, what I realized is, my goal when I got into medicine, I really wanted to help people. I wanted them to be healthier and happier. And of course, the Hippocratic Oath to do no harm. But what I saw happening almost immediately was this epidemic of chronic illness, and patients were getting sicker. Things like diabetes, heart disease, autoimmunity, autism, you name it. And I was giving out a lot of pills, a lot of medications, and those are definitely needed for sick people, for sure. We need those. I'm not against medication, but they weren't getting healthier and they weren't feeling better. And that really bothered me because that's why I went into medicine. So that's when my real journey started into what I call real medicine.
It's the same as my own journey, same as really anyone. I'm sure if your experience, if it echoes the same as anyone who really has gone into medicine to help people to feel healthier and happier. How quickly did you realize that?
It
wasn't the path?
You know, it was almost right away because of the background I had had in my undergraduate, but it was over the years, obviously, that I developed more and more critical thinking and saw more and more what was happening. I wouldn't say it was instant, it was more like a journey.
Yeah, yeah. And I would say, yeah, mine was within the first 1 to 2 years. That
Yeah.
really what we were doing, what we were taught to do. Well, we didn't, I mean, I was a decade almost later than you, but we didn't learn about health or well-being. We learned about, I call it death, decay, and disease.
Yes,
Right?
absolutely. And I think the first part was, you know, being aware, developing the critical thinking to be aware and learning about that. But then what do you do about it? How do you get the knowledge to change it in a system that is really a disease care system, not a healthcare system? That wasn't easy.
Yes. And we've both been through quite a bit of challenges, like anyone who's tried to deliver that real healthcare, real medicine, because first we had to learn, right, what that real medicine is through nutrition education, fitness education, all of that. And then also figure out how do you give it to people without having to charge them an arm and a leg or anything really. My goal is, you know, how do we not charge anyone anything, because we're wasting all these billions, trillions internationally on giving interventions that are not making people healthier and happier, or connecting them to their power, but really taking them on this downhill path that they've been told that they're going downhill, right? After 40 typically. And we're just kind of, instead of the steep being like this downhill, we're kind of just maybe making it like this, but they're still going downhill. So do you want to share how you started maybe on the path to really to take it on momentum to help people shift from going downhill to uphill?
Sure, absolutely. I think the first thing was educating myself. And there was no real formal program back then. So it was just a lot of reading and going to conferences. Most of these were in the States. So it's very expensive and there's no funding for this. Later on, there were more formal programs, for instance, through A4M or the Institute of Functional Medicine. But again, the cost can become astronomical for doctors. I know if you want a certification, you're looking at more than 6 figures. So I didn't end up doing the certification, but I took the courses. And one of the big influencers in my life and how I changed my thinking was Dr. Jeffrey Bland, who's the grandfather of functional medicine. And a great book, I think, for anyone to read to put things in perspective is called The Disease Delusion. And what Jeffrey explains in that book is that our genes are not our destiny. For instance, you know, we think that if our parents have colon cancer and we have the gene for that we're going to get colon cancer. Or, you know, if we have that gene for heart disease, we're going to have a heart attack. But what I learned through him and other sources is that our genetics are really only 20%. But environmental factors are so important and can make a difference whether or not those genes are turned on or off. For instance, good nutrition may turn off that gene or turn off the mark that causes colon cancer, whereas a toxin might turn it on so that you develop colon cancer. So in a way, this is great news because it means we have control. And if we can learn what to do and learn how to have healthier lifestyles and other modalities, then we can hopefully change health outcomes.
And that's a whole field of epigenetics as well, right?
Absolutely.
That the environment and what we're doing, and even our thoughts, I find our thoughts are so powerful. So nutrition's really powerful. Our thinking, our psychology is really powerful. Our movement, our breath is really powerful, and we can transform the way that those genes express themselves. And did you find that when you started talking to people about this, like your patients about this, what was their response?
Well, when I offered patients alternatives, like I find some of this actually came from patients. They didn't always want another medication. So when I asked them if they would like to look at more lifestyle issues or nutrition, and most patients were quite open to that. Of course, you always have certain patients that like, no, just give me the medication, and that's fine. But I gave them an option. They were always willing to look at that. And I can give you an example. I used to see a lot of teenagers, and I would particularly get high school students and university and college students coming in the winter with depression and anxiety and sleep disorders. And they were offered medications, but a lot of them didn't want that. They didn't want to go on medications. They had heard about side effects and they wanted other alternatives. So I would look at, and of course, depression, all those things, they're multifactorial, and we know there's different things that add in, and stress and relationships and all those sorts of things. But there are also nutritional things as well. And I would do a blood panel and we'd look at their vitamin D levels, because I'd learned a lot about vitamin D. And I would find that most of these university students were low in vitamin D. And when we treated them, they would come back in 6 weeks, and it was remarkable. Like over 90% of them were sleeping better, better mood, etc. And, vitamin D is kind of my number one thing. It's like when people come in, they say, I only want one thing. I recommend vitamin D, because it's really a hormone, and we know that it's responsible for more than 2,000 genes and plays a role in preventing so many illnesses, especially the chronic illnesses.
I'm so glad you brought up vitamin D, because this is the time to be speaking out loud across the planet on vitamin D. Because exactly in my own practice as well, when I started checking I check everyone for almost a decade now. I do the panel where everyone's blood test is checked for vitamin D. And invariably, especially when I was working with the police force here, a third of the patients would come back with very, very low levels. And like your experience, bringing that vitamin B with high amounts, daily recommendation for them to take, I would retest it 6 months later. And within a month to two, I saw even severe cases of depression, low energy, muscle aches and pains, just like miraculously transform. And yet we were never taught about vitamin D. It was I learned it through my own studies on nutrition and just like probably how you did, right?
Absolutely. And, I agree. I think we need to blood test and follow people up, because everyone's not the same. And I think that's the thing too, is talking about individualized and personalized medicine. We're not all the same. And some people may need large amounts and other people may not need such large amounts. So, and I always talked about getting people to at least the middle of the range. And in Canadian units, get them up to 120 to 150. The American units are different.
Yeah.
And you can check that in the blood. So it's really a simple thing to do, very inexpensive, and huge health impacts. And we know in Canada, we don't get sun in the wintertime.
Yeah.
So how can we maintain adequate vitamin D? And even in the summer, when you test levels, it's shocking, but with the amount of sunscreen, and I think the time we spend indoors with air conditioning, we still see low levels.
Yeah. What would you educate your patients on what that vitamin D is, which again, I do as well, where, educating them on what are your lab test results? What are they, what shows good kidney function versus not great kidney function? What are you doing in your lifestyle? What is that vitamin D and where should it be? And I found, that people actually are really, really grateful for that information and knowledge, because again, now they're not somebody that's, weak or treated as if they don't know anything, right? They're an independent, sovereign human being, and they are being given the right education and support and guidance to own that sovereignty in their own health and well-being. And once they're given that, they're just like on autopilot. They take off.
Yeah, absolutely. And I think you made a good point. It shouldn't be a command and control where we say, you take this or you do that. I think it's more about educating. I actually see myself more now as an educator, more and more as time goes on, than a physician, and working in collaboration with the patient and empowering patients, sometimes even being a traffic director and telling them where to go, right, to find the information or get the resources that maybe I can't do, because I sort of I mean, I've always believed that health, and I know it's defined as our, physical, emotional, mental, and spiritual well-being. And as a physician, although sometimes I think we're asked to fill in all those gaps,
Yeah.
I saw more my specialty is helping them have their best physical being, and obviously support the other areas, but that was sort of my expertise. And if I could help them in that area, and then with these other areas, give them the resources or other team members so that they can, their entire health, their whole health could be looked after.
That's right. And where that health then becomes the foundation of their potential to express the genius within.
Absolutely.
Before we leave vitamin D, because of the time that we're in right now, can you share what your recommendations are and its relevance to the COVID crisis?
Sure, absolutely. Well, we know that vitamin D is very important for our immune system. And specifically with COVID and influenza, we actually do have good scientific double-blind peer-reviewed studies that show that there is reduced mortality in people who have the flu and COVID if your vitamin D levels are adequate. We've known for years that the elderly who die of the flu are more likely to be vitamin D deficient overall. So I think it's even more important with what's going on now that we should get our vitamin D levels checked if possible, and if not, at least take reasonable amounts to protect our immune system. Yes, it's quite dramatic for sure.
So what's
simple and inexpensive? I said, and something simple and very inexpensive that we could do, right? Like, let's give it to all the people in all the long-term care homes.
Everyone should be. My parents, when they were there, the first thing I did in March was call before I brought them home later in the last fall, and have them both on a very relatively high dose because they weren't going to be able to be tested. We both would recommend, like we said, having the blood level tested, right? But most people, especially in the weather like ours in Canada here, can be on 2,000 to 3,000 easily units a day. And the elderly usually have very low levels if they were to be tested, or dark-skinned people actually as well.
Yep.
Yeah, have
Absolutely.
low levels.
Yeah, so for people who don't get their blood tested, I usually recommend you can safely take 3,000. I personally don't recommend more than that unless they can get their blood tested.
Yes.
And I recommend drops or capsules just because some people, it's more a matter of preference, I think. So I often give it either the drops or the capsules, depending on patients' preference, and to add in K2 because K2 keeps the calcium in your bones, and would be generally 100 to 200 micrograms of vitamin K2 per day. Okay. And there's some studies doing it, showing too it can be cardioprotective, and you can either take them separately or together in a tablet.
So with the vitamin D3, that's right. So the maximum that I would, without testing anyone's blood work, is that 3,000 units a day.
Yes.
And people will start noticing a difference within usually a few weeks, if not a month, actually, in terms of their mood and their energy. Muscle aches and pains as well. And we know low vitamin D per long periods of time also can increase cancer risk. So it is a very, very important vitamin to have. But the recommendation would be get your blood work done to see where your levels are at, and then retest about 6 months later. Because for some people, I've seen that it takes really, really long time for their levels to come back to normal.
Yes, ideally. And I agree with all you've said.
Yeah. Anything else? And then obviously with the immune system. Oh yeah. And for some people who can't take it every day, just to make it easier, you can take it. I do this once a week. I sometimes take 20,000 units. I'll do 20 drops. It just makes it easier to take.
Yes, absolutely.
Yeah. And recommendation would be to obviously talk to your healthcare practitioner about it. But it is such an important, because we haven't heard it really outside in terms of this period of how important it is. And so I'm glad you brought it up. So Carolyn, if you were to go back and see the transformations that you've seen in and I like to call them, I don't like the word patient anymore. So this new era that we've entered in, I like to call them participants in our program. in our wellness program, we call them participants. Patients just already has the assumption that the person is sick and is now coming to the almighty physician who's educated and, and is now going to fix them. So, these participants, people in their own healthcare journey, can you share some of the stories that that will give people some inspiration and hope in terms of everyone that's listening? How can they, at this time, there's so much stress happening, right? Everything is an unknown. People have had poor lifestyles for a long time. More than 50% of our North American population anyway has a very, very unhealthy lifestyle. And now in this crunch period of stress and the poor lifestyle, people are like, well, what am I supposed to do? Can you maybe take us there so that there's some inspiration plus the education for our listeners?
Sure, absolutely. And maybe I can talk a little bit about what